Hi guys, my name is Naomi Jankowski. I'm an acupuncturist and Chinese medicine practitioner practicing in Victoria. Just a little bit about myself before we start. I have been working as an acupuncturist for the last 16 years, and I have the great privilege to work with a lot of the endo community down here in Victoria. I've been working predominantly with endo patients for the last 6 years, and these are just some little tools that I would suggest for some endo patients that they might be able to take home and use at home for a little bit of support that you guys can get that way. So just a disclaimer before we begin, the presentation does not replace treatment provided by medical and allied health professionals. The treatment of endometriosis responds best to multidisciplinary care. Please consult with your medical practitioner before commencing with any of the information provided. So just to note that this is very generalized care. We're not providing medical advice today. So my name's Naomi Jankowski. I'm an AHPRA registered acupuncturist. I've been working quite specifically with endo and pelvic pain for quite a few years now. I work in a multimodality space alongside GPs, gynecologists, and other allied health practitioners. And I'm so passionate about what acupuncture can provide for the endo community. I really think that the future of endo belongs in this multidisciplinary care environment, and I'm hopeful we can give you guys a little bit of tips and tricks today. So I thought what might be most relevant for you guys at home is if I run through a couple of acupressure points that you can teach yourselves quite easily. These are points which I use specifically for patients with a lot of inflammation that's present in their body, particularly kind of gut inflammation, or what I often talk about as bowel type pain with endo. What you might be experiencing, and these are just some suggestions, they might be things like bloating. A lot of you might be experiencing endo belly, so really significant bloating that's really painful, uncomfortable. You've got that typical presentation where one day your tummy is really flat, the next day it's incredibly distended and very sore. And lots of other gut-based inflammatory symptoms. So potentially, maybe your pain is worse before or needing to use your bowels. Sometimes I say this to patients and they don't really kind of click with that initially, but the next time I see them, they're like, actually, I think that is me. A lot of the time, this pain is centered a little bit more on the left-hand side of your lower abdomen. And the reason for that is because the anatomy of the colon kind of descends and ends on that left-hand side. So if there's predominant inflammation in the bowel, causing maybe constipation, but maybe also this pattern of like constipation then with diarrhea that alternates between one and the other, that can cause this left-hand sided pain. Obviously, again, this isn't medical advice. Left-hand sided pain can be from lots of different things, especially in an endo presentation. But if you are having this kind of presentation alongside bloating and endo belly, this may be something that is relevant for you. And then we might be able to consider these acupressure points. Keep in mind also that acupressure is very gentle. It's a very different situation to if you were to see an acupuncturist who's giving you a whole treatment with needles. Needles are obviously a lot stronger and giving a lot more of a therapeutic effect. And we in clinic are definitely working with how you present to us on a case-by-case basis. With that in mind, you can use acupressure yourself very safely at home. It's very gentle. And these are just a couple of points that I will show you guys the videos of how to locate these points if you suspect that you have this kind of gut-based inflammation. And then you can find these points for yourself quite easily and apply some pressure on these at home. Now, with the video that's just about to start, you'll notice that these points aren't located anywhere near your belly. They're actually located both points on your feet. Acupuncture works in weird and wonderful ways, but we work with nervous system pathways, and this means that we can often use distal points, so points on arms and legs, to treat the pelvis and reduce inflammation with points located there. We'll play these videos now and then have a bit of a chat about them.
So there are two acupressure points that we can use, and I'll show you guys how to use those two. To find the first one, we're looking between our biggest toe and our second toe, and then we're coming down to where there's a little gap between these two toes. You should feel this nice juicy little space here. It feels like a little hollow, and that is a great acupressure point if you've got central lower abdominal pain. So pain below your belly button, kind of where you feel your uterus is. And you can press into that with something like a pen, or even better, press into it with one of those pencils that has a little eraser on the back. Pressing in nice and deep and holding on that and seeing if that relieves your pain.
Great. And then there's just a follow-up video.
The second point is between the second and third toes. And again, we're finding that nice juicy gap between the two tendons. This one's a little further down, a little bit closer to the ankle area. If I tense up my tendons there, you can see how there's a gap between them. And we're looking for this little spot where you'll feel that your finger almost can travel quite a far way down. Again, you can take something like a pen or a pencil with a little eraser on it and press into there. If you don't have any of those things, using your finger is just fine. You'll notice that I'm pressing almost at a 45-degree angle towards the big toe. This point is especially great if you suffer from pelvic pain, but you also have issues with bloating and gastrointestinal problems. I often use this point especially for patients who have a lot of bowel pain. So maybe they have constipation or loose bowels and they have pain when using their bowels.
So just to note that you can use those points at home for in cases, for instance, where you're having a little bit of a flare in your pain, especially if your flare is coming on at the same time as all of those gut-based symptoms. I did have a case where I think I put a couple of these points up on my Instagram, and someone sent back a DM saying that they found these points incredibly helpful during the course of a flare that they were having. They kind of didn't know what else to do at that time, and they used these alongside other things at home like heat packs, TENS machine, etc. And she found that while applying pressure on the point, she had a real improvement in her pain. As the video said, the first point that we went through is excellent for pain in the lower abdomen. And to keep things simple, you can basically use this point on either side, so either your left foot or your right foot or both. You could also ask a family member or your partner or a friend to press on these if you kind of need to be laying down, or if you're really in a lot of pain and you just need to rest in some kind of like seated position with a heat pack on you as well. If your pain is very predominantly on one side, so say, for example, in the case where you're having predominantly left-hand sided pelvic pain, we would actually recommend to apply pressure to these points on the right foot. So with acupuncture, it tends to work contralaterally, so opposite the side of the pain. With that in mind, if that's really complicated during a flare, just apply pressure to either side during that flare and see if it might help in alleviating some of your symptoms. And last thing to note here, patients will often ask, or people will often ask, how long to be applying pressure for. There's not really solid rules around acupressure. You can apply pressure for as little or as long as you like. I would suggest something like a period of about 5 minutes. If you could get someone to apply pressure in that time frame, you should find some relief within that time. Also just wanted to chat about some general lifestyle and dietary approaches that I suggest for a lot of my patients in clinic. Probably the main differential point in terms of Chinese medical dietary therapy is that we have a real emphasis on the thermal nature of foods in our diet and how this can impact and affect the body. If I would say this is especially important actually for the kind of patients that we're talking about where we're seeing a lot of gut inflammation. Our theory on this is that our body and our digestive system functions at body temperature. So ideally what we want to do is we actually want to input both food and drink that is at least at body temperature and really ideally not cold in nature. For example, if we're having things like really cold smoothies that maybe have like frozen bananas, frozen strawberries, cold coconut milk or soy milk or something from the fridge, it's almost like I would describe that as being good in theory, but really difficult for your body to tolerate and process in practice. And the reason for that is that your stomach needs to basically heat everything up before it can start to extract the nutrients. For people who have a lot of that gut inflammatory type of symptoms, lots of bloating, poor appetite, maybe nausea, etc., this is especially important. So basically, your gut is already working very hard and maybe not as strong as we would like it to be. We can assist that process as much as possible by actually eating and drinking warm food and drink. So examples of what I might be suggesting for patients to avoid are things like cold smoothies, cold juices, cold kind of acai bowls or smoothie bowls, and also ideally not adding ice to their water or drinking water straight from the fridge. Water is really important as well. From our perspective, it also puts that strain on the body where our kidneys or our renal system need to work extra hard to heat that water up, to bring that water up to body temperature before the body can start to assimilate those fluids well. That would actually be especially important for patients with things like frequent urination. But I would suggest that as a general rule of thumb for all patients, that ideally we want to be having water that's either just at room temperature, or if you're living in cooler climates like we are here in Victoria, in the winter, ideally you would actually be drinking warm water, cups of hot herbal tea, that sort of thing. In the summer, just room temp at the coldest. So patients often then ask if they can have some examples of what to have for breakfast. Maybe they've typically been having things like smoothies or smoothie bowls for breakfast. Warm breakfast options that might be potentially a better fit for you. Things like porridge or eggs. Eggs are such a great way to start the day, giving you lots of protein. You can add in some veggies as well. Really good for blood sugar regulation too. Or if you are interested, you can also have something like a congee, which is a kind of rice porridge that is made in a lot of Asian cultures. For lunch, if we're thinking about this idea of thermal temperature again, if I'm talking to patients and they're typically having a lot of things like salads for lunch, again, great in theory, a little bit hard to digest potentially in practice, especially if they're keeping that salad in the fridge and then just taking it out of the fridge and everything that they're consuming is cold and also raw. As a potential swap out for that, could suggest something like heating up some leftovers from dinner from the night before. I find that we tend to have really nutritious dinners, like we put heaps of emphasis into cooking a super nutritious meal, usually has protein and veggies and all sorts of things. If you can get into the habit of just making extra, so you've got leftovers, heating those up, ideally in a non-plastic container for your lunch, is a really, really good way to have a nutritious and easily digestible lunch that shouldn't kind of impact a lot of those bloating and other type of digestive gut inflammatory symptoms. Other small suggestions from a Chinese medicine perspective also: eat mindfully. I always say to patients, eat for enjoyment. Food is there to be enjoyed. It's there to be enjoyed with other people or just individually. Whatever food choices you make, enjoy them. And I often suggest, live in this kind of 80-20 way. 80% of the time, maybe you're doing your best and you're trying to make good choices for your health. 20% of the time, make some of those choices that maybe they're not the best things for your health, but you're really going to sit mindfully and enjoy those choices that you've made. And that is okay. And that is part of life, to enjoy those simple pleasures. We also say, from a Chinese medicine perspective, eat until you're 7 out of 10 full. The idea of that is that it takes a little bit longer for the rest of the food to actually get into the stomach area. We don't want to overburden the digestive system. That's going to help, especially if you suffer from bloating as well. And some of you probably want to have a bit of an idea about what acupuncture might be able to do to support you with your endo and pelvic pain. And I really love this question. I think it's really great to go into something with an understanding of what you are trying to achieve from that and what therapeutic outcomes you might be able to gain. I would very broadly say that acupuncture does 3 things for the endo-pelvic pain community. One of those things is that we can improve blood flow in the body. So if there are particular areas in the pelvis where that blood flow is a little bit congested and causing pain, acupuncture is great for that. In terms of that, just as a side note, we actually don't need to apply acupuncture to the pelvis in order to improve how the blood is flowing there. We can use this type of distal acupuncture to achieve that function. The other thing I would say that acupuncture is great at is it's fantastic to reduce inflammation. And as we know, endo is an inflammatory disease. Acupuncture is excellent for targeting pain that is based on inflammation. For instance, you might be experiencing all those gut-based symptoms or other type of inflammatory symptoms in the pelvis, and we can work with that with acupuncture. The third thing I would say that acupuncture does extremely well is it's good for pain sensitization. So I'm sure that this is something that is already known to a lot of you, but pain sensitization is this idea that after you have had chronic pain, and actually chronic pain for pain sensitization is anything over a 3-month period of time, which I'm sure a lot of you have unfortunately had symptoms for a lot longer than that. But it's shown that after 3 months, the brain starts to form these nervous system pathways where it basically gets used to prompting pain. Your body is potentially, after that, in this state of fight or flight, and your brain is saying, I'm not safe. I need to continue to push this pain message, even though there may no longer be anything that's anatomically wrong or anatomically dangerous. Acupuncture works through those nervous system pathways to put your body into a state of rest and digest, and to tell your brain that it is now safe, and we can start to unwind those chronic pain pathways. Thank you so much for your time, and really appreciate you all being here.